Hello, my name is Gerardo Betancourt, and this presentation is about COVID-19 and HIV responses, critical analysis from an HIV community organization. That's a publication that I did at the beginning of the pandemic, and it reports how our program, Community Without Borders, that was an intervention, face-to-face intervention, had to be adapted to the new times that we were experiencing. So COVID-19 remind me a little bit all the history I have read about HIV and AIDS. I know there is a lot of controversy and some people don't like this idea. I do understand the stigma and the whole generation that got erased due to AIDS, HIV, lack of information, lack of funding. And it was up to the organizations, community organizations and individuals to start informing and educating the communities before governmental action happened. So Community Without Borders was a 3-year project, an intervention. The objectives were to increase sexual health among participants, increase HIV sexual health testing regularly, develop critical awareness and resilience, and aim for Latinx in Spanish. All this with the intention of complete and meet the standard and the expectation of Toronto to 0. The historical reaction to AIDS in North America, it's been public and it's been acknowledged in the way that happened. HIV/AIDS workers got the expertise of working with communities. We got trained in how to access information, how to share information, and how to meet our clients' needs. With COVID-19, we're facing some stigma as well, and there will be plenty of studies that it will be coming up soon about how people were controlled or informed on all the policies and media that was published around the COVID-19 issue. For many individuals who had survived the wave of HIV/AIDS from the 80s and 90s, and even today, maybe COVID-19 was a trigger of emotions and fears and commonplace that we thought they were behind forever. So in the book and the play and the band Play On, we can see the medical discourse and how governments and our institutions, universities, didn't pay attention to AIDS and HIV until it was too late. In the same way, on the same token, we can see how COVID-19 got immediately a reaction from media and faster reaction to public policies, public health policies. But in a way, it was up to all the HIV and AIDS ASOs and organizations, community programs, who had all the training and they know how to access their communities first. Who are the most sensitive for getting infected to COVID-19? Minorities, elders, individuals with other comorbidities, people who are highly at risk of HIV. The common factors are correlated to the social location and intersectionality of each persona. When first we realized that we couldn't complete our meetings face-to-face, and before we started with the Zoom meetings in the way that we completed our year, what we did as a community worker, frontline worker, was to start a social marketing campaign about how to keep safe distancing and how to inform people what we were learning at the time. Remember in February and March, we didn't know exactly all what we know now. So there was lots of fear, there was lots of anxiety, and our clients responded to the isolation. So the whole point of my paper and this article that got published is that I consider that for COVID-19 responses, organizations who have been working with HIV and AIDS and sexual health efforts are best equipped to conduct the COVID-19 efforts to reduce infections. Thank you.